Bien,
Thank you. Good evening.
nuevamente un saludo a
Evening.
todas las personas que nos
Hello to
están
everyone
viendo y
who's
sintonizando a
watching
través
us and
de
who's
los diferentes
tuning
medios
in from
de
different
comunicación.
media.
Como todos los días a
Just like every night,
las
we're
7 de la
here
noche
at
estamos
7
aquí
p.m.
en
here at our
la sala de
conference room in
conferencias
the
del
National
Palacio
Conference, in
Nacional
the
para
National
tener el día de
Palace.
hoy la actualización de
And we're
nuestros
here to talk
diferentes
to you about
panoramas,
different
tanto el
contexts,
internacional como el
national and
nacional.
international.
Pero también el día de hoy
I'd also
quisiera
like
darle
to
la bienvenida. Es la primera
welcome
vez que nos acompaña.
our
Está con
head,
nosotros la
Fabienne, head
jefa
of her
Fabiana.
unit.
La jefa Fabiana es la
Now,
titular de
she
la
is joining
División
us
de
from
Programas
the
de Enfermería
National
del Instituto
Institute
Mexicano
of
del
Social
Seguro
Services
Social,
for Nursing.
y el día de hoy tiene una participación también
Now, she's
importante
had a
dentro de
very
todo
important part in
este esquema.
participating
Doctor
during
Hugo
this
López
time.
Gatell está por llegar. Él estaba
Now,
participando, tuvo de
we
hecho
are
que
waiting
dejar un
for our
momento la
last member
sesión
to join us,
del
but
Consejo de Salubridad
he
General, que fue
was at
citado
another
hoy día a las
conference
5
at
de la
5
tarde a
o'clock
sesionar,
today,
así que en
so in a
unos
couple more
minutos
minutes,
más debe
he'll
estarnos
be
ya
joining us.
acompañando. Entonces,
Let's
vamos
begin.
a iniciar el día de hoy, como
Now,
hacemos normalmente durante todas las
we like to
conferencias,
start right
con las
away
actualizaciones de
and
los diferentes
give
panoramas
updates
en
on what's
relación a
going on with COVID-19.
COVID-19. En la
Now,
primera
our first
diapositiva
slide,
estamos ahora presentando
we're
directamente y
going
con
to
esta
be
modificación
showing
del
you a little bit of a
gráfico.
different
Si recuerdan,
graphic
con este
this
gráfico
time.
estamos dando seguimiento a cómo
We're
se está
going to show
comportando
you
la
how the
pandemia para
pandemic
cada una de las
is
regiones de la
behaving
Organización Mundial de
according
la Salud.
to the WHO.
Este fin de semana, precisamente,
Now,
la región de las Américas tuvo
America,
el alcance
the
de rebase
Americas
a
has
la región europea,
overtaken
y lo que
Europe.
vemos ya el día de hoy
Now
es
let's take a
cómo
look
se
at how
mantiene
that
ese incremento.
increase
Ahora la
is
región de las
maintaining. You can
Américas con el
see about
46%
46,
prácticamente sobre un
45% here
45
of
de los
confirmed
casos
cases.
confirmados, como ustedes
As you
saben, en
know,
los
this has
últimos
happened over the
14 días.
14
Algo que
days.
habíamos estado también viendo día con día es
Now,
cómo esta
this
cantidad
number
de
of
casos confirmados en
confirmed
los últimos 14 días
cases
se iba
was going
disminuyendo,
down
disminuyendo a nivel
globally,
mundial, lo que habla
which
un poco de la
talks
contracción
speaks a little
de
bit
la
to the
pandemia como tal.
contraction that has been going on
48% son ese
worldwide.
1.103.000
You
casos
can see here
en
that we
que
had
tienen mucho de síntomas en los últimos
1,103,000
14 días, y por lo
confirmed
tanto son los
cases in the
casos
last
más
14
recientes y los
days.
que mantienen
And we can
viva
see the
la
total
transmisión, ya que de
cases
estos casos
worldwide,
es que se podrán
which are
contagiar
over 2
a otras
million.
personas, que son las que se irán en su momento sumando
Now,
a las
these
cadenas
are all the
de
people that
transmisión. Entonces ya lo veníamos
have been
diciendo también desde
transmitted,
algunas semanas. Vamos a ver
have
qué tanto se
transmitted the
mantiene
virus
este
and are
diferencial.
infected.
Eso va a depender qué tanto crece las epidemias en los diferentes países
Now,
de América y qué
we're
tanto
going to
empiezan a
be able to
menguar o
see
ya a
what
controlarse
epidemics
las
have been
epidemias en los
controlled
diferentes
in
países
different
de
countries, both in
Europa.
Americas and in
En
Europe.
la siguiente diapositiva
On our
vamos a
next
estar ahora
slide, we're going to be
presentando
showing
las
you the
cifras
numbers.
distribuidas o en función de la utilidad de la
We're going
información.
to take
Vienen
a look
todas,
at
ahorita
all
las
of
vamos a ver
them
en las
over
siguientes
the next slides.
diapositivas. Vamos con la
Now, the
primera de
first
ellas, que
one,
normalmente
which
es la
is
que
what we
siempre actualizamos
update
para el tema nacional,
first, is
que
the
son
national
precisamente los
context.
casos que
We
se han
have
confirmado.
8,702 cases
8.772
confirmed.
casos son los que se encontraron en la
This is how
plataforma
many
al
we've
corte
had
del día de
registered on
hoy,
our platform
y pueden ustedes ver
today,
la distribución
to the
que
moment
ya
that we
también
cut off
habíamos estado
counting.
presentando día con día
Now,
en
here
cada
you can
uno de
see the number
de
of
los estados.
cases in each
Por mucho
state.
la Ciudad
Now,
de
the
México es donde
majority of
concentra la
cases are
mayoría
in
de
Mexico
los casos.
City,
Esto también
but we
tenemos que
also
verlo desde
have
el punto de
to
vista de la
think
perspectiva
about
que
this
responde a
in
la
terms of
concentración
the
poblacional
population
que hay
concentration
en estos
of
lugares. De
Mexico
hecho, como
City.
ven, el Estado de México
So,
es el que ahí sigue.
following
Entonces
Mexico
tiene que ver
City,
un
we have
poco
the
también
state of
dónde inició
Mexico, and this has to
para
do
México,
with
para el país,
population
los primeros
density.
casos de transmisión comunitaria, y en su momento
We
entonces
can
cómo se
also take a
comportaría
look at how
la transmisión.
transmission
En
has
la siguiente diapositiva
been
vamos a
spread
ver la
over the
distribución por
other
tasa
in the
de
other states.
incidencia
Now we
acumulada,
have
2.32 para todo
2.32% in the
el
whole
país, o sería la
country.
tasa nacional
This
por
is
cada
per
100.000 habitantes,
100,000
pero entonces vemos cómo esta tasa
inhabitants. You can
se
see
comporta
how
de
the
manera
behavior
diferente
is
dependiendo de
different
cada una de las
over different
entidades
states.
federativas.
Now, when
Donde
we
veamos una entidad
have
federativa con un
state that
color un
darker
poco más
concentration
oscuro,
color,
quiere decir que la
that's where
tasa de
we have a
incidencia es
higher
mayor. De hecho,
incidence of
tenemos la
COVID.
escala
Now,
colorimétrica
where
a
it's
un lado
lighter,
del
you
mapa, y
can
con esa
see
podemos
there's a
identificar
lower rate of
Aquí se refiere y es
incidence.
precisamente donde en la base
So
poblacional, es decir, la
this
cantidad de
speaks
personas
as
que
well, again,
residen
as
en
I
ese
said,
estado,
to the
pues entonces
population
tenemos
density in
mayor
each
o
state.
menor afectación. Aún
Now,
así,
even
sabiendo
with this
que la Ciudad
information,
de México
you
es
can
la que
see
tiene
that
una de las mayores
Mexico City,
bases
with
poblacionales
its
junto con el
high
Estado de
population
México,
density,
también tiene
also
además una
really
coloración
has many
oscura,
confirmed
quedando también en
cases
los
there. So you
primeros
can see that's why
lugares
it's in
junto
first
con
place.
estados del sur como
Now,
Quintana
in
Roo y
Quintana
estados
Roo
también
and
del
in the northeast,
noroeste como son
as well
áreas de
as
California y
over
Baja
in
California Sur.
the west,
En la
it's
siguiente
not as
diapositiva
concentrated.
vamos a notar
Let's take a
precisamente
look at
la
confirmed
distribución de
case
casos confirmados.
distribution.
Ahora estamos
Now,
viendo los
our
casos
active
confirmados
confirmed
activos por
cases
entidad
by
federativa, es
state,
decir, los casos que
you
se
can
han
see
confirmado
here.
con inicio de
This
síntomas
is
en
over the
los últimos
last
14 días,
14
es
days,
decir, los
so
casos más
clearly the
recientes.
most
Estos
recent
representan
cases.
a
This represents
2.965 de
2,900
ese gran
total.
total. Y entonces
And if we
podemos
take a
ver,
look a
más allá
little
del
bit
acumulado,
beyond
en un gráfico
the
previo, estamos viendo
cumulative
cuál era la
number,
carga confirmada acumulada de
we can
casos
see exactly
por
how
entidad
this
federativa.
affects each
En
state.
este gráfico lo que podemos
So
ver
we
es
can see here,
cuál
what is
es
the
la carga
cumulative
acumulada de casos
number of
activos,
cases,
es decir,
the ones
todos
that have
aquellos que han iniciado en los últimos
started in
14
the
días para
last
también
14
tener
days,
esta
and
otra
in
perspectiva, es
what
decir,
states they're
en
in.
qué estados estamos teniendo
Now
la
you can see who
transmisión
has
más
most
reciente, es
recently
decir, donde se
been
encuentra
infected with the
activo
disease.
la dispersión, la
Now,
transmisión y
of course, we
usualmente,
also have to
lógicamente,
take
también los
into account
brotes que se
outbreaks
están dando
here at the
a nivel
community level.
comunitario. Y entonces aquí
So you can
podemos
see
también
over
ver, por
here
ejemplo,
in
la Ciudad
Mexico
de
City
México
that has this
encabezando esa tasa
high
de
incidence
incidencia
rate
por
per
100.000 habitantes, en
100,000
relación con los
inhabitants. And you can
2.965,
see how
y
the
los
other
demás estados que
states
también tienen que ver
behave with
con
respect to
esta base.
Mexico City.
Esto está
Now,
calculado
these
solamente en
cumulative
función
cases
de
are
los casos
just
confirmados
for
activos, no del
active
acumulado total.
cases,
Es para
not
ver
total
dónde está la
cases.
transmisión más
Let's
reciente.
go
Si
to
vemos
our
la
next
siguiente
slide.
diapositiva,
Now
por
we
favor,
have
tenemos
the same
los mismos
cases, the
casos
same cumulative active
acumulados
cases over
activos, es
here.
decir, con inicio de síntomas
And of course,
en
as
los
I
últimos
said, this is over the last 2
14 días,
weeks,
pero entonces,
but this is
acumulados
cumulative
por
by the
fecha de
date that symptoms
inicio de
began.
síntomas. Esto es un poco
So
para ver
here we
también
can see a little
cuál
bit
es
the
la
trends that
tendencia
is
que está
happening for
llevando la
transmission
transmisión,
over
en
the
este
last
caso,
14 days.
en los últimos 14 días de transmisión. La
Let's go to the
siguiente
next slide.
diapositiva. Aquí tenemos
Now here we have
el
an
número actualizado de
updated
defunciones,
number
712
of
en el día
deaths
de hoy.
today, and we
Tenemos
have
la
it
distribución por
distributed by
grupo de
age.
edad en los que se han producido estas
Unfortunately,
lamentables
these deaths, we
defunciones.
see
A su
exactly
vez,
where,
cada grupo de edad
in
está
which age
identificado
group,
por
in which
sexo.
sex they're
Hombres,
affecting.
mujeres, ya
The
veníamos
men, as we
viendo
have
de las
seen over
últimas
the
semanas que
last
siempre
few
los
weeks,
hombres
have
han
had a lot
concentrado
more
la mayor
deaths,
proporción,
68%,
68% al
by the
corte
cutoff of
del día
today.
de hoy. Y vemos
And that we
una
also see
mediana
the
de
average
edad que
age is
está en los
58
58
years
años,
old.
con los rangos que en
And
su
this
momento
is
hemos
within
estado
the
ya
age groups that we
identificando de
have
cómo
been
han sucedido
taking a
estas
look at in
defunciones.
terms of
En la siguiente, por
deaths.
favor. Aquí
Here
tenemos
are
las
the
defunciones
cumulative deaths
acumuladas
by
por
date of death.
la fecha de defunción, ¿sí? Pero
Now,
además de
besides
las
just
defunciones que en su
being
momento son
confirmed deaths,
confirmadas, o sea, es decir, que ya
that
tienen
means
un
a positive
resultado
result for COVID.
positivo a SARS-CoV-2,
These are the ones that
que
are
son
in
las que
dark
están en
blue.
color azul oscuro. También
We
están
can also see
en esta
identified on
gráfica
this graph
identificadas
those
aquellas que todavía
suspect
son
cases. So
sospechosas.
this will give
Eso
you an
nos da una
idea of
idea
the
del
global
comportamiento
behavior,
global,
in
en
this
este caso por
case,
cada
on the
fecha en la
date
que
of
han
death,
ocurrido
by
estas
date of death.
defunciones, y
And
entonces
so
nos
here we
pueden
can
dar
see
también
what
una
is the
expectativa, ¿sí?,
expectation
de
for
que
how many
cuántas
deaths we
defunciones
might
pudiéramos también
consider
esperar
there will
para
be in the
cada uno de
future.
los días, además
And
de
we
que
can
nos
also
ayudan a ver
see
también un poco
and
la
observe
tendencia
the
de
trend of
cómo se
how
están
deaths are
comportando las
happening,
defunciones,
whether they're
independientemente
confirmed
si
or
están
not
confirmadas
confirmed of
o no están
having
confirmadas, es
COVID.
decir, si vemos
So with the
el gráfico
complete
con la
bar
barra
on this
completa,
graph,
¿no?
we can have an
O si
idea,
solo nos
or if we
enfocamos
take a
en las
look just at
azules,
the
bueno,
dark
podemos
blue,
entonces en su
then we
momento
can
ver un poco
see
la
the
tendencia
ones
de
that
cuáles son las
have
que ya se
actually
han
been confirmed.
confirmado hasta el momento. Pero
So
tenemos ahí un
the
grupo que son las
gray that
grises
we
oscuras
are looking at
que en su
here,
momento
these are
también
cases that we
pudieran
might
sumarse a la
see added
estadística
on
de
to the number
defunciones
of confirmed deaths that we
confirmadas. Si
have.
ustedes empiezan a analizar un poco los gráficos,
So
sabemos que
please
se comparten
understand
y
that
están a
this
disposición
information
de
is
todos. Es
public and
información que
that
se ha
you
venido
can consult it
presentando en las
anytime, just
últimas
like the information
semanas,
we've been looking at
agrupada o
over the last
distribuida
couple of
de
weeks.
una manera diferente para encontrarle utilidad también a la forma de cómo se presenta. En la
Now, on our
siguiente
next slide,
diapositiva
this is the same.
tenemos
We're still looking
igual
at
las
deaths
defunciones
that have
en su
happened,
momento que
but
han
this is
ocurrido, pero
by
por
state.
estado o por entidad federativa en las cuales se han
We
producido, y
also
también
have, for
tenemos para
each
cada uno de
state, you
los
can
estados
see how
cargado el
many
dato de
suspect
defunciones
deaths there
sospechosas,
are.
es decir, todavía
So, in terms of
la
that
carga de
actual
defunción de
number
la
of
cual
deaths,
podría
it might
todavía
be more. The
sumarse
gray
cada uno
is suspect
de los
cases that have
estados,
not
y
yet
que en su
been
momento pues,
confirmed.
pudieran representar más defunciones que las que solamente se han confirmado hasta
Let's
el
go to the
momento.
next
La siguiente
slide.
diapositiva,
Here you can
aquí tenemos el
see
porcentaje
the
de
percentage
positividad.
of
Se incluyó
positivity, the
además, estábamos
positivity
presentando, si recuerdan,
rate
los
for
porcentajes de
COVID.
positividad de COVID-19 de
This is
influenza
the black
en la
line,
línea
the
negra
dotted
ahora, a la
black
línea
line
punteada
right
negra
here.
o segmentada negra.
And now
También
we
se
also
ahora
have
incorporan
the
porcentajes de
positivity rate
positividad de
for other
otros virus
respiratory
respiratorios,
viruses.
a los cuales también
So
se realiza una
we did
búsqueda,
take a
sobre
look
todo
at very
en los
serious
casos
cases and
graves y en
deaths
las
to
defunciones.
see
Podemos ver
that
que
the
tampoco
other
son otros
respiratory
los virus
deaths
respiratorios que
are
pudieran estar
also
predominando ya
having
en
a
estas
serious
fechas. Vemos
effect. And we also
cómo
want to
las
take a look
líneas de color
at what the
naranja y
rates
de
are
color
that are
negro,
in
que representa
comparison
el
to
negro a todos
COVID.
los
So you
demás
can
virus
see the
respiratorios, y las
orange
naranjas
is
precisamente a la
positive for
positividad de
flu
influenza, están
and the red
prácticamente
for
pegados a
SARS
la línea
COVID
base,
2.
lo cual habla de un
So
porcentaje
you
de
can
positividad
see that
menor
there
al 2
is
o inclusive
less
al
than 2 or
1%.
1%
Y
positive
vemos
for some
entonces
of
cómo ya
these
la
on the dotted
positividad, y esto
lines
es,
along the
como lo
bottom.
pueden ver, es
You
por
can also
fecha, no es
see
por
by
semana epidemiológica,
date
sino es por
how
cada
many
una de las
cases there are.
fechas,
And you can see
como la
if
línea
you look
roja
by date
oscura,
and
que es la que
follow the red
representa
dotted
a
line,
SARS-CoV-2,
this
es la que en su
what
momento
has
se ha
been
mantenido
higher
por encima, llegando a tener inclusive
than
en
over some
algunos
of the last
días
days and the
picos
last
en la
updates that
última
we've been
actualización
hearing.
ya por arriba del 30%, es decir,
So
que
3
3
of
de cada
every
10 casos
cases
han
have
sido
been
este
SARS
SARS-CoV-2. Y
CoV-2.
bueno, hay una
So that
variabilidad
has
menor
been
en
that
los
has
últimos días,
dropped, decreased
pero
a little
como hemos
bit in the
estado
last couple
presentando
of
día con
days.
día, vemos cómo
And
esto
so
en la
you can
medida que se van
see how
confirmando
these
o
cases are confirmed
dando a
or
conocer
how we
más
start to
resultados
get
de
more
laboratorio,
laboratory
pues esto
results
entonces empieza
and
también a
see
cambiar y
how
empieza a
this
tomar
trend
la
starts to
tendencia que
change.
en su momento podemos observar ya
Now
desde
we
el
can see since the 24th
24,
from
25 de
March
marzo en
up until
adelante,
now, you
que ha
can
sido
see
una
that that
tendencia ascendente en este
positivity
porcentaje de
rate is
positividad.
going
Lo veníamos
up.
también
And
diciendo
you
desde
can
hace algunas
see how
semanas, que en la
over the
medida que
last
esto
weeks
fuera
it has
avanzando
been
y se estuviera
advancing. And you can
llevando a
see
cabo la
how
dispersión de la enfermedad,
the
vamos a
virus
empezar a
is
encontrar
spreading.
cada vez más SARS-CoV-2 entre las personas que están
So
teniendo
this is what's happening
síntomas
because people are
respiratorios
having
agudos.
serious.
En la siguiente diapositiva
See
podemos
our
ver nuestra carga
cumulative
acumulada de
load
casos
of
confirmados,
confirmed
los
cases. We have
8.772 el día de hoy.
8,772
En las
today.
últimas
And in the
24
last
horas sí
24
tuvimos
hours, we
una
did have a decrease
disminución
in the
en la
number of
carga de casos
confirmed cases
confirmados, es decir,
or
las
the
personas
number
que
of
se reportaron
people
como
who
positivas fueron
felt that they were positive.
511, y eso
So
representó
this
un
means
6.2%
6.2%.
en
It has
comparación
gone
a lo
down
que se tenía
from yesterday.
reportado el día anterior. Si recuerdan, el día de ayer fue del 10%, con un poco
So
más o
it was a little
cercano a los
closer up
800
to
casos
8,000
confirmados. Y
cases
pues bueno,
yesterday, but
vamos a
we are
ver
going
esta
to be
tendencia cómo
keeping a
se
close
mantiene.
eye
Ya
on these
habíamos
trends
tenido
and
situaciones
seeing how
similares en
they develop.
la gráfica de
If you
barras
see the
naranjas en la parte
orange bar
inferior en
graph at the
las
bottom, you can
semanas
see how
previas,
it's been
pero cada
advancing week by
día
week,
es un
but
nuevo
every
dato
day
y es
it's
un
new
poco la oportunidad de
information,
ver cómo se
so
están
we can
llevando a cabo
see how the trends are
estas
developing.
tendencias. Sería
Now
la
that's the
actualización del
update
panorama de hoy.
for the context today. Thank you so much. Good afternoon, everybody. Let's continue with our session, and it's a real pleasure to have you here for the first time. I hope it's not the only time or the last time. Welcome. Welcome, Fabiana Cepeda Arias. Now, she is the head of nursing at IMSS, Mexican Institute of Social Security. Now, it's wonderful to have you here today. We have so few opportunities to have nursing people here. Now, it's great to have a totally different perspective from you, the nursing perspective. And I think this is very relevant for what we're talking about and how we're controlling this today. Dr. Fabiana, thank you. Thank you. Good afternoon.
Buenas tardes.
Thank you, Dr. Lopez Catel, for inviting me here today. I really appreciate this. I would like to introduce myself to you. My name is Fabiana Cepeda Arias, and I am here in charge of nursing at IMSS. Now, I have 131,000 nurses under my charge, and they are throughout the whole republic. Now, I'd like to begin my presentation by recognizing and saying thank you so much for the work that more than 400,000 colleagues of mine at EAMS do. And these people, we're talking about doctors, nurses, people who work in nutrition, who are cleaners, people who work in social service, people who work in administration, in daycares, assistants. There are so many people, there's so many actions that we're taking to be able to deal with this contingency. And we're convinced that everything that we're doing and all the efforts that we're putting in, they're worth it. Now, I would like to talk to you about some of the actions that we're taking with regard to COVID-19 control. Now, as you know, at our institute, at EAMS, we've always had two objectives, two mental objectives. The first, of course, is for people to get service who have EAMS Social Security. And today, as well, our priority is the safety of our colleagues. Now, you know that recently we have gotten personal protective equipment that we really needed for our hospitals. I want to talk to you a little bit about these flights that we received on Aeromexico. We received 4 different flights. Now, we've been so excited about getting this protective equipment because this is going to guarantee, without a doubt, that we're going to be able to help patients and stay safe. Now, we got the first one on April 8th. It had 370,000 pairs of gloves, latex gloves. That's that we're going to be using to touch patients, and 820,000 KN95 masks. We received another load on April 10th that had 400,000 surgical masks. And then we also got 1.5 million masks, or a different type of mask. And then we also had 180,000 KN95 masks. Now, again, on April 18th, we received more protective equipment to the tune of 192,400 pieces. On the 19th, we received our fourth load. We got 2 million, almost 3 million surgical masks and 46,600 goggles. This equipment was so necessary for our units. Now, could you help me with the next slide, please? Now, today, we have a logistical system that is very important in place, and this has to do with personal protective equipment. Now, with logistics, there's so many hands, so many people, so much coordination going on that we are getting this distributed to our 35 different areas of specialty. And we're doing this so quickly. This has historically never been done before. Now, besides this, these actions in some way or another are focused to ensure that our colleagues are safe while they're doing their jobs. Thank you. Now, something else that we've been doing, and this is really good, this is the COVID bonus. Now, this is unprecedented. This speaks to the need that we've seen in our colleagues, and they need an incentive. Now, this incentive is about awarding health professionals who are available and who are going to be having direct contact with COVID patients, we're going to be giving them an economic bonus. Now, they're going to be receiving that starting, and let me tell you, this is above and beyond their salary. They're going to be getting this, it's going to be 20% of their salary. Now, there are people at IMSS who have this infectious contagion point that is they're directly related to, they're directly having contact with people with COVID. So, this personnel who directly has contact with people with COVID are going to be able to receive this compensation. This is going to start well, it started on March 16th, and it's going to go on until the authorities decide or see that this pandemic has ended. Now, it's very important to mention here that we are also going to be giving this to all medical personnel, family doctors, or from different specialties. They will also be receiving this. Now, the reason this action, the action we're taking, we never thought we were going to be doing this. But let me tell you, April 14th was when the National Guard was sent to our hospitals. Now, we have 184 reconverted hospitals for IMSS that have been retrofitted to deal with COVID patients. There are going to be 1,600 National Guard members who are assigned to be surveilling the doors for people who are coming in, who are driving in, and they're going to be taking care of our people. Now, this is something that is without precedence. So the thing is that safety within our hospitals, it really needed to be reinforced. And it's very much worth it because we need more safety. This is not just for our workers, but this is also for patients and the families who are there to see what type of medical attention their family members are getting. Next slide, please. I'd also like to share something with you. Now, we have had some aggressive action against our personnel. Now, people have been stigmatizing and discriminating. There has been violence against health professionals. Now, even people have come to hospitals and been aggressive. And these people are attacking health professionals who are taking care of people with COVID, or even without even knowing if they are or not. Now, today at IMSS, up to now, we have 21 aggressive acts against nursing staff in 12 states. 12. Now, this represents a little bit less than half of the whole country of Mexico. Now, we have identified these aggressive actions through different media. Now, the states where these actions have occurred, this is Mexico City, Yucatan, San Luis Potosí, Sinaloa, Jalisco, Puebla, Morelos, Coahuila, Guerrero, Quintana Roo, and Durango. Now, these aggressive actions, in these states are the ones that we have identified against my colleagues, but there are more. There are more aggressive actions that are being taken against nursing and doctor personnel, and the media is identifying this. And I would like to appeal to you. I would like to appeal to the media. Now, media, you are so important because everybody believes you. Everybody believes what you write. You guys are what you are writing. You guys are doing a great job. And I want to really have your support. I want to appeal for your support. Now, please, I want to make this an extensive appeal for respect. Look. Now, this hurts. This hurts to talk about this. It hurts. It hurts when you hear what's happening to people who you work with, to your colleagues. Now, I want to talk about health workers. Look, we're people. You know what? We have families. And you know what? Today, we're leaving a lot. We're pushing it to the side. We're leaving our houses to the side, our families. We are pushing, we're leaving our lives. And we're dedicating ourselves to our work. And you know what? We're not forced to do this. We decided to do this because every day we decided to do what we are. And that's who we are. I am speaking for all health professionals. Everyone who has a uniform, everyone who's convinced that helping people is the best thing. And because they're professionals, because they're ethical, because they give over their whole selves, because they love humanity. In other countries, we have seen how health professionals, you know, they even do homages to them. They clap for them. They write letters to them to thank them. Restaurants send them messages. In Mexico, that happens too. We also have to talk about the good. In Mexico, we also do get words of support. We also do have many people who understand our work and what we do. We receive support from civil associations, from business people who are convinced that the effort that we are putting in is important. But you know what? Without a doubt, we appreciate that. But the WHO, the World Health Organization, well, they really do dictate what the health regulations are worldwide. Well, they just declared that 2020 was the year of childbirth and nursing. We never thought that we were going to celebrate this year. We never thought that this year we would be showing all our abilities. But what better opportunity? We are showing everything that we can do to contribute to health services. And these contributions, these are not just by nurses. This is by every single one of my colleagues. And they're all on the battlefield every single day. Now, this year, 2020, you know what? We have our eyes wide open. And we are very proud to be at the spearhead of this battle. This year, 2020, this is the year of nursing, because surely the results, they're going to speak for themselves. I just want to speak as well to the population who is listening to us right now, to people who, like me, just the average Joe and Jane, you live at home, you have your family, your friends. No, to all of these people who believe in us, thank you so much. Thank you truly. Thank you. And also to those people who have assaulted health professionals, I would like you to stop that. Now, we can save your lives. Help us, please, to take care of people. We need you to take care of us. We need to learn, and we need solidarity. We want to be together as Mexicans, independent of whether we are health professionals or others. We need solidarity. We need that solidarity that we were talking about, that Maestra Zoe Robeldo was talking about. We need solidarity for Mexico. And we need to breathe life into each other to go forward with this. Now, I assure the population, you know what? These aggressive acts, these have hit us hard. These have really affected us. Because now we have to deal with other things. We don't want to deal with your aggression right now. Nobody does. Now, truly, please, please respect us. Now, this uniform that I have today, I've been wearing this for 27 years. And I wear it proudly. And you know what? It's the same as doctors. And it's the same as everyone I mentioned. Every professional has a uniform and they wear it with dignity. Today, we take it off in the streets. You're not going to see us wearing our uniform. And you know what? That has a lot to do with the damage and the aggressive acts that you have been doing. Now, to end, to sum up, now, the people we are dealing with COVID patients, we're not dealing with them like you think. This is my clinical uniform. This is when I'm dealing with COVID patients, I have a totally different uniform. That's where we're talking about the personal protective equipment. Now, when I'm touching or near COVID patients, I'm wearing a totally different uniform. So if you see a nurse or any health professional outside in the street, please understand that that's not the uniform they're wearing when they're near COVID people, COVID infected patients. Now, as soon as they're finished dealing with COVID patients, they take off the whole uniform. They wash their hands extensively. They do all kinds of other disinfecting activities after they've had contact with COVID patients. They take all kinds of preventative actions so they would not be infected and take that infection home to their family. So please be calm. Understand that we are not going to transmit COVID to you in the streets. It's the total opposite. We are helping you. We're doing what we love and we give our whole selves over to our professions. Now, with that, I will be ending. And I would say, Dr. Lopez Gatel, at any other time, please, I would love to bring the good news to this conference and also just to bring you tranquility, to know that IMSS are with you. We are with you. The health sector is with you. You know very well, sir, that we've been working so hard on this. And we are going to need to reinforce our position in a number of ways, but we all have the same objectives. We want to go forward. Thank you so much. I really appreciate that.
Thank you very much, Mariana Maribel Cepeda. You represent not only IMSS, but also all the health personnel. This message that you have communicated today, and that is extremely important, and you're always welcome to come here. I will be holding you to that. Yes, of course. All right, let's begin with the Q&A period. You've been asking a lot of questions, so you're a new one, and welcome you and you. Good evening. We're having some problems with the sound. The question is not. Yes, indeed. The sites in which we have a higher density, a higher population density, and in specific those sites in which we have reduced mobility for any reason that is, they require particular precaution and particular attention to measures. The general measures have to do with washing your hands constantly, with early identifying those people who exhibit symptoms, and of course when you're dealing with populations that because of their age group they are subject to a higher risk, then they require a very, very early attention because they are the ones who could present complications potentially. We have a set of guidelines about enclosed spaces specifically, and these guidelines can be accessed through the official website coronavirus.gov.mx, and there you can find some specifications regarding these spaces you were asking about, for example, homes for the elderly or childcare facilities or migrant attention centers. We have created these guidelines and they are available to the public and to the people who work at these cases. Let's remember that not all of us live under the same circumstances, and there are some people in some populations who require particular care. Next question.
Buenas noches, Bianca Aguirre de Notimex.
Good evening, Bianca Aguirre from Notimex TV. I wanna say that today we saw more. We saw a slight increase in mobility today. We heard about some companies bringing their workers back to work today because of the economy that is receiving an impact. And also we had reports of some nurses, some nurse personnel who are waiting to be engaging in training, but they haven't received the official call. So what's happening? Well, the specific data about the recruiting program that you're asking about, the specific data, I don't have it to date right now. But tomorrow, Tuesday, I'll be updating this information specifically. And when it comes to the health professionals who have registered and they haven't been called, as the situation you are describing, please be patient. We are still organizing the recruitment process according to the necessities of each federal institution, and we are prioritizing according to specific elements. So there are some people who were under the impression that they were going to be recruited immediately, and they may have to wait a few days, but all of them are going to receive the call. And all of them are going to be recruited as long as they meet the specific requirements. And the mobility related question, well, the reason I was a little late today is because I was presenting to the General Health Council a series of elements that we have to consider for the phase 3 of the pandemic and how we can make the recommendations made by the scientific team even more effective. You all know the recommendations made by the scientific team because we presented them on a morning conference a few days ago, but we presented these recommendations in a more formal manner to the council so the council can consider them. And one of the concerns expressed by one of the members of the council was specifically the concern about the relaxation or about the reducement of these measures of safe distance, and we were all in agreement that it is very important to keep in mind that the national safe distance journey and the massive mitigation measures the period has extended. So please, all of you and the population who are listening right now, do not think for a moment that we are coming out of the epidemic right now. We are on the stage of the highest and the most intense increase in transmission rates. And even though we have had some success in the effects that we desired when implementing our measures, these massive mitigation measures are not over. This is the moment to emphasize the stay-at-home message, because contagion is still happening, and it's happening faster and faster. This is no surprise to anyone. This is exactly what we knew was going to happen as we moved towards phase 3. So it is very important still to stay at home and to prevent contagion from keep happening. Now, as the weeks go by and as the days go by, the amount of pressure we're subject to is increasing, because this is a situation that is affecting the economy, of course, and we knew this. These are not ideal, but we made the decision of implementing them because they were necessary for the health of our people, and at all times we were trying to keep a balance between the health of the people and also the economic situation and the economic health of the population, because this also has a repercussion on people's overall well-being. So we made the choice, and we are acting accordingly, that we will only continue to implement these measures as long as it is strictly necessary, and that is what we are doing. Good evening. Tere Moreno from Universal Paper. I have a couple of questions about, the first one to Dr. Alomia. I want to ask you, these states that you and municipalities that you were talking about, which they're starting to have community outbreaks, are these communities the ones in which the phase 3 is going to first be officially declared? And Dr. Gatell, I want to ask you, how close are we from phase 3? I know this is not an overnight thing, but last week you were saying we were pretty close, so how close are we? Also, I would like to know if within the hospitals, health centers, and different institutes, is there a protocol for the relatives of the patients to say goodbye in any way to the hospitalized relatives who are in critical condition, who are intubated, because what we have seen in some cases of violence that have appeared in hospitals, sometimes these aggressions are explained on the basis that these are mad relatives or angry relatives who wanted to say goodbye and couldn't. Of course, this is not justification, but what is your take on that? You are very right about that, and this is a reality that is very complex. This experience that the families have to go through, and I'm talking about the families who lose a loved one from their lives, and it comes to them as a surprise, and it comes to the communities as a surprise, because this is a disease, and I want to make this very clear for the population. This is a disease that can, from one moment to the other, what seemed to be under control is suddenly out of control. What seemed to be manageable, it's suddenly unmanageable. Sometimes people who have mild symptoms, they think they are already recovering, and they might end up presenting complications and even developing pneumonia, and in some cases, unfortunately, they even lose their lives. And that is why we've said, and we've had emphasized recently, those senior citizens, those people over 60, the pregnant women, the people who have some sort of chronic disease, especially diabetes, hypertension, obesity, pulmonary disease, immunosuppression of any kind, kidney failure, do not do not get too confident. If you exhibit any COVID-related symptoms, you must seek medical attention immediately, because if you present any kind of complication, and if this is early detected, the possibility and the probability of saving that person's life is higher. When it happens that unfortunately a patient loses their life, this is a complicated situation because now we have to protect the lives and the health of the relatives. And of course we know that the close exposition to a person who has been infected with COVID, with the virus SARS-CoV-2, or even that same person, after losing their lives, they can continue to be a source of infection. So we have to protect those people who are still alive, even if they are their relatives. So the protocols we have contemplates the limitation of the exposure, because otherwise we would be endangering the lives and the health of the people who are still alive within that family. There is no other reason for this. This is a biosecurity element. Have you thought about video calling or other ways to do it? Yes, of course, there can be different types of adaptations, but this is a dramatic scenario we're dealing with because the people who end up losing their lives, it is very probable that they are in a state in which they cannot communicate anymore because a lot of them are intubated. So and the remains of the people who die are delivered directly to the funerary homes. Yes, that is correct, and this is included in the set of guidelines for the management of the bodies. They have to be directly turned over to the funeral homes, and this is all in the technical guidelines, with the exception of the people of the bodies who haven't been identified so far. Those ones cannot be cremated. And yes, this new chart that we were presenting when we gave the national landscape, you remember we had been identifying the people who are recovered now, who have been infected for more than 14 days, and they didn't present complications and they didn't die, of course, and now they are considered recovered. Now we have a different angle on this because now we are focusing on the people who have been sick during the past 14 days. And when we do an accumulated incidence rate distribution, we can also make a comparison between the different states. This is an activity that can be done also at the municipal level. So at a given time, we can identify clearly which regions and which states and which municipalities of the country have a higher concentration and have a higher transmission rate. This is sort of what we were doing, the exercise we were doing when we compared, for example, the European region situation and the Americas situation, because then we have which region has a higher transmission rate and then needs for us to pay closer attention. And we do that same thing on the national level, because those communities and those municipalities in which the transmission is stronger, something is happening there. And we can make these comparisons because we are taking into account the population. So a higher, when you take into account the population and you still have a higher transmission rate, something is going on there. And maybe you have to emphasize the abiding of the national safe distance program measures, or maybe they are not being abided by some sectors of the population. So you have to see what's happening there so you can start bringing those transmission rates down. And when the time comes, we can regionalize the different measures, and then we can have an overall control and a real control of these very complex outline and this very diverse development of the epidemic, in which not all regions are presenting the same developments when it comes to the transmission of the disease. So this is a new way of managing this information and analyzing it. Thank you. I want to ask, I'm Araceli from Canal 11. I want to ask you about this meeting that you have at 5 p.m. with the General Health Council. What topics were discussed? What can you say about this meeting? Yeah, the topic I was presenting at the meeting was the COVID topic, and specifically the measures that are relevant to phase 3. How close are we? We're really close. I have been literally saying this for 15 days. We're very close. We're moving towards phase 3. As I said before, declaring phase 3 is not only a matter of the number of cases, it has to do with the community dispersion, and also when there's a sustained transmission in different regions of the country at the same time. That's also a factor to take into consideration. And basically, when we are counting the cases by the thousands, then when we have a transmission process that sustains itself, then that's another element to declare phase 3. These proposals that I presented in the meeting, we made them public as proposals. We presented them to the public before officially presenting them to the Health Council, so you know this information. These were the recommendations that were a result of the work of the scientific analysis team, and they basically consist on maintaining the extension of the massive mitigation measures until May the 30th. Also considering some specific regions that, as we move towards May the 17th, are showing very low transmission, and maybe considering lifting some of the restrictions in those regions starting May the 18th, but if and only if they are under control. Sometimes, for example, those municipalities and those regions that we are currently identifying as under control, but then they go out of control before May the 17th, then of course we will not be lifting any restrictions there, and vice versa. So it really depends on the quality of control. This is a very important duty that is responsibility of the state authorities and the municipal authorities to make sure the mitigation measures are abided by, and also to do their fair share when it comes to detection of cases, to isolation of cases, because if a municipality achieves to have a controlled situation when we reach May the 17th, then they will be able to lift restrictions. Also, this proposal of segmenting, regionalizing mobility, because this is very important. We don't want people from a municipality that has higher transmission rate to go to a municipality that has a lower transmission rate, and we don't want the contrary either, because if a person from a low transmission municipality goes to a high transmission municipality, when they go back to the low transmission municipality, they are gonna spread the disease. So we want to keep, this is one of the proposals, to have regionalize and restrict the mobility between different municipalities. And we will be discussing and designing the specific methodology for these measures, and it will be the responsibility of the state authorities to implement these measures and to monitor that they are complied with. Then we have time for 2 more questions. Yes, you, and then you.
Lisbeth
Alvarez from Grupo Cantón. My question is for the
Sin duda alguna, hoy las
chief nurse.
son los heroínas, las heroínas,
There's no doubt that today nurse personnel are the heroes amidst this crisis, but beyond those measures to protect them, don't you think there should be more severe legal consequences for those people who attack this health personnel? Well, I'm not really well versed in legal matters, but if I can talk from a health perspective, I do believe that there must be a limit for the population who is attacking our health workers, because it is a right. We have a right to being respected, and I think we have earned that right every day with our work. So the people who are in charge of dictating the legal dispositions, I think it would be a good recommendation for them to make the limit clear, because this is a matter of respect. Good evening, I'm Paula Betancourt from Multimedios. You've said several times that the special team for treating COVID-19 patients, the special equipment, the specialized medical protection equipment is only for the people who are directly dealing with COVID-19 patients. So why don't we give this specialized medical equipment to all health personnel? Because in some hospitals, we have reports of patients that arrive with a different diagnosis from COVID-19 and they are treated in such a way, but they could be suspect cases, or they could be confirmed to have COVID later, and then this could pose a risk to this personnel who doesn't have access to the specialized medical protection equipment. Yes, it is a very valid question, and that is the way it must be. What I have emphasized on many occasions is that out of all of the elements of the personal protection equipment, there are some of them that provide with the maximum barrier or the maximum isolation protection, and these elements are physical barriers such as goggles and N95 masks. So these are the ones that must be used no matter what by those health professionals who are engaging in direct processes that have to do with that are directly dealing with these COVID-19 patients. But other health professionals also have access to different personal protection equipment that corresponds with the duties that they engage in, and this doesn't have to do with experience, with how long they've been there, with rank. This has to do with their specific activities they are engaging in, and those diseases that are not and those medical units that are cataloged as non-COVID hospitals or non-COVID units, there is the possibility of a suspect case going to that hospital, and the health professional that is gonna interview this person, who is a subject case or could be a subject case, will also have medical personal protection equipment. Not these goggles, not this N95, but it will have proper medical protection equipment for the duties that they will be engaging in. Yes, I am. That's what I'm asking this question, because this ISTE hospital is a hospital that treats COVID patients, and they are reporting that they don't have enough equipment. Well, that would be it for today, and we can continue with this topic tomorrow. Thank you.